I think all ophthalmology residents, as they begin their training, all have to go through an intern year. So that's either in internal medicine, general surgery, or a transitional year. At the end of the PGY1 year, you begin your actual ophthalmology training, which is very exciting. The first year is really about building your clinical knowledge, and we're fortunate at Mass Eye and Ear to have an emergency department dedicated for eyes as well as ENT. But that really gives you a unique opportunity to see a lot of pathology. It's probably one of the most interesting places you'll ever experience as an ophthalmologist. And at the completion of your first year of ophthalmology, when you start your PGY3 year, you really take that foundation you've built and go out across all of the Harvard hospitals and provide consult coverage and start to really gain more OR experience, which we do have in the first year, but I think you build upon that second year, and most of our second year trainees finish with about 20 to 25 primary cataracts. So you do get a good OR experience. And then going into your last year of ophthalmology training, it's really about becoming a competent surgeon. So it's a very, very surgical heavy year, both in terms of cataracts, becoming a competent cataract surgeon, and among subspecialties. So you get exposure to cornea surgery, glaucoma, retina, and I think you build upon each year the skills you've learned so that when you graduate, you're not only a competent clinical ophthalmologist, but a competent surgeon. We've also recently built into our curriculum research time throughout all years, because we have an opportunity here at Mass Eye and Ear to work with some amazing clinician scientists. And so that's built into our program as well, which is something that's very unique.
Actually a pretty hard question, and I'm not going to actually answer your question in a single answer, but I'm probably going to pick my top 3 favorites just because there really isn't a single one that I can pin my head on. Number one really is just the people at Mass Eye and Ear. The resident class, we're so lucky to have such a large resident class. Having 8 co-residents, you build really this family of support, both among your class and the other classes, but especially within your class. They're like your best friends. You just are a huge family, helping each other out and helping to kind of make each other the best ophthalmologist you can be. And then you have the incredible support of our faculty. I feel like, it's just as the years goes on, just more and more people just try to take you under their wing and just say, how can I help you achieve what you want to do with your career, whatever that is. And that's just a really amazing experience to have kind of mentorship just at your fingertips at all times. Then Marissa mentioned the ED, and it's a really special place, but I think it represents just the diversity of pathology we see here, which I think is almost unparalleled. Just the things that we see on an everyday basis. I've recently done another set of nights with our junior residents, and I mean, we were seeing everything from crazy tumors, compressing both orbits, to multiple RDs, to, perforating corneal ulcers, to just like really impressive pathology that we're seeing on an everyday basis and managing on an everyday basis. As a senior resident, it's really exciting being a surgeon and like growing in surgery and just like seeing myself grow every day that I'm in surgery. I've been operating with Dr. Solo the past couple of weeks. It's just been really fun. And so that's definitely like right now, that's my highlight, is kind of just seeing like every single case, seeing my growth as a surgeon and seeing kind of the trajectory to where I can go. The worst things, I guess, like any residency, is probably just your lack of control over your own time, and kind of, trying to make sure that you make time for yourself and making time for your hobbies and for your wellness. And it's something that I think is something that we all have to work on at all times and pretty much at all areas of training. Luckily, we continue to work as a group and support each other, just like I said, with all my co-residents.
There's basically a fellowship in ophthalmology for every subspecialty of medicine, in that we have pediatrics and we have neurology, we have our oculoplastics, we have all of those things. Within those fields, it might be worth just to divvy them up in terms of surgical and non-surgical. Ophthalmology in general is actually a surgical field, so we do a lot of surgery and stuff. And so whether you don't do fellowship and you just become a private practitioner as a comprehensive ophthalmologist, or if you subspecialize in something like retina or glaucoma, you will be doing surgery, whether that's cataract surgery or retinal detachment surgeries or fixing glaucoma, lowering pressure. So that is a big decision point for whether or not you want to be an ophthalmologist. But even if you are not so sure about surgery, or later on you're just like, this surgery thing isn't really for me for whatever reason, there are other fields. I kind of took a different approach this year and became an ophthalmic telemedicine fellow. And so that in and of itself is kind of unique. There's many ways to kind of subspecialize within the field of ophthalmology. I won't like belabor that, I guess, but one thing to know, one piece of advice that I give all med students all the time is that if you're going to a program, one way to kind of sort between programs and rank them in your mind is if you have specialties at that hospital or that clinic, and each specialty has multiple physicians in that specialty, you're going to get better training than a place that only has like one glaucoma surgeon and one retina surgeon. That's because there's no one way to skin a cat. And if you're able to take all the pieces of advice or all the different surgical techniques from multiple teachers, then you're going to be a better doctor down the road and be able to make better decisions about what your style is going to be. So I guess the second half was typical residency, track, post-residency. So I'd say the majority of residents that come through Mass Eye and Ear do go through a fellowship training program. Most of them are 1 or 2 years in nature. And after that, they end up going into either private practice or they go into academics. So the big decision point there being in private practice is mainly dedicated to patient care, although you can do research and clinical trials. And then if you do academic medicine, you tend to do research as well, and then you do some level of teaching, again, either medical students or residents or both. So that's kind of, I think, the trajectory. A lot of people from Mass Eye and Ear tend to take on leadership roles at various academic institutions across the country down the road.